I'm just going to take a few minutes now just to kind of explain kind of what I'm thinking has been over the last few months of kind of coming to a point of having the Dementia Choices Action Network and kind of how we see it moving forward. And as we've heard today, you know, embedding personalised care around dementia is really important. And James mentioned, you know, it was in the long-term plan, and we're also not doing this just in isolation with dementia. We're looking at other programmes as well. So Ian mentioned there, you know, you don't just have one disease or one condition. We're looking at how we embed personalised care with cancer as well, stroke, CBD, lots of other conditions. And each one is taking slightly different approaches and different relationships in different ways. And for me, the Dementia Choices Action Group is very much a very collaborative way that we want to work together. So, we have a small group, we've kind of nicknamed ourselves the DCAN-Doers, I suppose. This is kind of built on the delivery team, that's pulling this stuff and driving this stuff together. And you can see from the list there, again, that it's very collaborative. So there's myself, Ian, and Claire. Claire is in the room. Claire, do you want to say hello? Claire is one of our senior managers in NHS England and Improvement overseeing dementia. So we're really getting the steer from an NHS England and Improvement perspective from personalised care and from dementia. And we've got Ian from the Alzheimer's Society. We've also got Laura here, who is working with all our partnerships, so C4CC and our partnerships team, to really make sure that we include all of our collaborators and make sure that you keeping us on task around all of that. We've also got some fantastic people helping us around integration and lived experience, and particularly around, we need some support around communications design and some project management support. And to be quite honest, without all those guys in the team supporting us, we wouldn't have been able to get to today without all of that working together. Not one of us alone would have been able to get to this point. So, the way that we see the Action Network, this evolved. We initially saw this as a group, and we thought, oh, that's okay. We can have a meeting. And then when we started going, but we need this person here, and we need that organisation here, and we need representatives, we suddenly realised this is much bigger than a meeting and a group. This is a network, and this actually, we can't do this as a small group. We need to be a network. So the way that we see it is we have a steering group, looking at this, which is made up of the delivery team, from personalised care and the guys that we mentioned there. We've got people living with dementia on that steering group. We've also got carers sitting on that, and we'll have some hub specialist reps. So if there's a particular theme or an area that we need to, we'll bring that rep into that steering group to make sure that we have that right information on there. So the assembly. So what we're suggesting is that as an assembly, as a wide and much larger group, we can probably meet 2-3 times a year, or actually we've got a chance this afternoon to talk about how we think that might work. We've definitely got 2 large assemblies on the agenda coming up. We've got one in November, which what we will do is we will make sure that these have a theme. So the first one in November is around social prescribing, and then we have a date in February. But again, this is very much collaborative. It's about coming together. It's like Ian's already said, it's about people bringing what's already going on out there, sharing, working together, and then making sure that we go out there and walk the walk, that we can implement that in our policies and the work that we're doing. So the hubs. So what we then decided... So yeah, so in the assembly as well, again, to make sure this is collaborative, there will be equal spaces for people around that. So we've kind of worked around about 100 people to be at the assembly, where we'll have equal amounts of people living with dementia, we'll have equal amounts of carers, health members, social care members, people from the BCSE sector, and independent members. Plus then, if there's a theme, so for instance on the social prescribing one, we'd have expert panel members to bring that knowledge and information to that. So again, we're making sure that we're not dominating it anywhere from one side. And then the hubs itself, essentially, are kind of bringing out our priorities and topics of areas that we want to work on. And again, there's some work this afternoon that we want to look at around some of those. And these will then do some deep dives into that area of special interest. And again, it will be very collaborative. It will be around gathering that evidence, that data that's already out there, looking at things that are happening, sharing that. Actually, you know, might even be thinking we need to look at commissioning something around this, or we want to know some more research about that particular area. And they will then report into the assembly meetings and can also support the steering group to make sure that we're driving things forward in the right way. Yep. So, we've kind of been thinking about a few priorities as a bit of a starter for 10, but we didn't want to come today as kind of a blank canvas. However, there is 5 things up there. They are not written in stone. They are not the only things that we think need to be addressed through the DCAN. But just to kind of go through them very quickly, so we really want to make sure that we have lived experience, so some work focusing around that. And especially picking up, I think, from what Jeremy said there around how do we make sure we get the lived experience voice of those that can't maybe articulate as much. And social prescribing, so looking at how we build that into dementia-inclusive communities. Personalised care and support planning, so again, like James said, this is the gateway to a lot of the interventions and the work, and having that really good personalised care and support planning. Research innovation, and then how do we scale and spread this stuff? This good stuff, how do we share that? And like we say, it's probably likely that we'll have a lot more of the things that we can share. So that's the bit of the idea of how the process of how we see this working. I'm going to hand over to Laura now, who is going to look a little bit deeper at the possibilities.